This is the skeletal system. This system has four main parts: the axial skeleton, the appendicular skeleton, the cranial, and the facial skeleton.
There are four types of bones: long bones, like the forearm and thigh bones; short bones, like the wrist and ankle bones; flat bones, like the ribs; and irregular bones, like the vertebrae or facial bones.
Stem, bone, stem, dancing bone, stem, bone, stem, bone, stem, dancing bone, stem, bone, stem, bone, stem, dancing bones, doing the skeleton dance. The foot bone's connected to the leg bone's connected to the knee bone's connected to the thigh bone, doing the skeleton dance. The thigh bone's connected to the hip bone's connected to the backbone's connected to the neck bone, doing the skeleton dance. Shake your hands to the left, shake your hands to the right, put your hands in the air, put your hands out of sight. Shake your hands to the left, shake your hands to the right, put your hands in the air. Wiggle, 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 wiggle. Tim bones, tim bones, tim, dancing bones, tim bones, tim bones, tim, dancing bones, tim bones, tim bones, tim, dancing bones, doing the skeleton dance.
Bones may appear to be relatively inert because of non-living material on the outside of the bone. However, bones are very much alive. Comprised of over 200 bones, the skeletal system is just as alive and functioning as any other organ system.
Bone grafting is a surgical procedure that replaces missing bone in order to repair severe and extremely fractured bones.
There are many bone grafting methods, but the most common procedure is to take a bone from a different non-essential bone. This process is very invasive and painful.
New research about stem cells and bone grafting may one day eliminate the need for these bone grafts.
Research from UCLA stem cell scientists found that stem cells from fat tissue can grow new bone. This breakthrough is significant. It could potentially eliminate the need for other bone grafting methods altogether.
Adipose, or fat tissue, is thought to be an ideal source of mesenchymal stem cells. These cells are cells capable of developing into bone, cartilage, and muscle. These fat tissue cells are plentiful in the body and can be extracted through minimally invasive procedures, like liposuction.
Before this discovery, doctors had already been using stem cells to create bone, but this new method is faster and much more effective.
Traditionally, cells taken from fat had to be cultured for weeks. This method increases risk of infection and genetic instability. While cultured cells can grow bone, the process takes weeks. Scientists use a cell sorting machine to isolate the perivascular stem cells from adipose tissue. They discovered that these cells work far better and produce much more bone than the culturing method.
Patients may one day have rapid access to high-quality bone. Doctors will obtain the fat tissue from the patient, purify that into stem cells, grow the bone, and replace the patient's fractured bone with the newly grown bone. That was easy.
So why is this important? Patients may one day have rapid access to high-quality bone. Not only can these stem cells be used to replace fractured bone, but they can be grown into muscle, cartilage, blood vessels, and can even be used to treat certain diseases.
This new breakthrough is exciting for use not only with bones, but with muscles and other organs. Further studies have been conducted that will continue to expand on these findings. These are our sources.